the entire experience and never really left her side.
When you think of a doula, you think that they're doing something for the mom.
Mm-hmm.
But how do you support the dad, the father?
We've had lots of experiences where we've talked to dads about what they want to do during this labor. And one of the most common reasons that we are hired in the first place is because the dad says, I've been through this class, but I still don't know what's going on. And that's perfectly understandable for him. He's gone to the class. He really wants to be there. He knows that it's essential for him to be there, but he's not a medical professional. He often has no idea what her experience is unless maybe he's been through birth before with previous children or whatever. He really doesn't know how to help her in labor.
And you can feel kind of helpless.
Exactly.
And probably the time you want to support the mother of the baby more than any is during this time of delivery.
Mm-hmm.
And if you feel helpless and hopeless type of thing,
they're often in labor themselves in their very own way. We really need to think about the dad as being just as much in labor as the mom, and we need to retire this whole concept of him being a coach. He's not a coach. He is the father.
Having a baby.
He's having a baby, and we want him to experience this labor in a way that's comfortable for him. We want the mom to be comfortable. We want the dad to be comfortable too. So the doula can provide that support. I've had many experiences where I may be rubbing her back, but that dad is right in front of her, helping her do her breathing. So we give him specific jobs to do, specific behaviors and specific things he can do with the mom to help her through the labor, and it's in that way helping him also. And we are doing some other piece of the whole picture to keep the labor moving hopefully smoothly and efficiently as possible.
If you were telling somebody that the greatest gift you can give a mom was a doula, let's summarize. How would you sell yourself to someone in your program?
I would tell them that, first of all, birth memories are the most important memories that you're going to have. And birth memories last forever, so that it is vital that these memories are happy memories and are memories where the mom feels like she really had control of the situation. The mom and the dad had control of the situation. Many times in childbirth we think of routines, things that are just always done. Well, maybe these are not the best routines to have for a specific mom. So this is what a doula does, is helps inform the mother of all the choices that are available, questions to ask her healthcare provider about her labor before she actually goes into labor, helps her decide which options are going to be the best for her, and also presents to her the information about the advantages of a doula, that we really can help shorten labor, we can really help minimize the possibility of cesarean delivery. We can minimize the use of epidurals, although many women still choose to have an epidural, and that's fine, but it is her choice. And we can assure the mom better that the epidural will be given at a time when it's really going to do the most good, that it's not going to hinder her labor. So I guess in summary, a doula is going to work for that mom and help her have the best labor that's possible for her.
When, again, let's talk about if you want to have a doula, and with today's thrust of preconception care and doing everything as early as possible so that we can have a healthy baby, when's the ideal time to call the birth consultants at the Carol Jo Becky's
Certainly by mid-pregnancy. By the middle of pregnancy, they should be getting a hold of us. We're thrilled when people call us early in pregnancy to start arranging for classes and the services of a doula. That's ideal, but certainly by mid-pregnancy. So somewhere around that fourth month of pregnancy, fourth to fifth month of pregnancy is a great time to call us.
But you can call preconceptionally and ask
Oh,
questions.
yes, absolutely.
And see if you want this to be one of the things. Because, again, that
Plan for.
That can be just talking to a doula can help you. Again, if you want that personal person to be there from the start to the finish, that can be something to request.
Exactly.
And again, you've talked about the classes, and the more prepared a woman is to give birth through the Lamaze classes or the childbirth classes, through having a doula, the less stress there is, the less worry.
There's lots of power in education.
And so I think that there's not one of those needs that can't be met at St. John's Hospital.
Right.
And again, let's give the number that someone can call, because the Resource Center at St. John's has a birth consultant in the Resource Center that can answer questions when anyone calls with any of these questions.
Right. Monday through Friday, 8:30 to 4:30 are our hours. And there's always an answering machine where they can leave a message and we will get back to them. The number is 535-3696.
And again, if we just want to talk about any of this and need support, need to talk about would it be good to have a doula, what kind of classes, what's going on, the Parent Helpline is always available to answer any kind of questions or to help you think of questions that you should be asking. And we are available in the Springfield area at 544-5808 or toll free at 1-888-727-5889. We're always here for you so you can be the best mom that you can be. Thanks, Cindy, for joining us. And think of a doula when you're thinking of a present for a woman who's about to have a baby. Have a good day.